First of all, on behalf of the Ministry of Health of Cambodia, and I would like first introduce myself. My name is Dr. Awan Lin. I'm the Secretary of State for Health, Ministry of Health of Cambodia. And as you may know that Cambodia is come from try to develop our country from the scratch. And so far, the health outcome has been improved in the past and recent years. The life expectancy of the population right now increasing in the average around 70. And as you may know that when the economic and development in the country go along the way, then the lifestyle of population also change. And we are facing the double burden of communicable disease as well as the non-communicable disease. And in terms of NCD, non-communicable disease in Cambodia, it's one of the priority strategy and policy among others that has been highlighting in the National Policy and Strategy 2016 and 2020. So we are trying to implement our strategy, and with the effort has been made, the multi-sectoral action plan has been developed and endorsed. And this multi-sectoral action plan on NCD from 2018 to 2027, it's kind of a guide to guide the multi-sector to work together in order to address the NCD in Cambodia. And according to the estimation, the percentage about 64% of the total death in Cambodia is caused by NCD, and mainly approximately 24% due to cardiovascular disease, and other come from diabetes, hypertension, and cancer, and other. And we are working a lot with other people in Cambodia as well as other partners to reduce the risk factor that increase the livelihood of NCD. And given the fact that Cambodia is still in the stage of development, and we still challenging with the technology, and most of the healthcare professionals, they are being trained, but they are most likely to work on the curative medicine, and the technology is moving, and especially right now we are in the stage of the fourth industrial revolution. So we need to adapt the way on how we respond and have our population, particularly the people in the community, that they guided and they aware of how they can prevent themselves rather than waiting until the disease come and seek the healthcare at the healthcare facility, which is very costly. So NCD, it can be prevented if the people know how to really respond and how to really work on the to really, especially on the nutrition, the food that they are eating. It's also one of the way that we can work with our population in order to improve the nutritional status, as well as contribute to somehow to prevent and reduce the likelihood of having the NCD. And as you may know that when the development coming, then the lifestyle change, and the people are more busier and busier than before, and they are more likely to eat the fast food rather than having the proper way of cooking food to eat. So that's why it's one of the way that we can also work in this particular area. And as we can see, with the modern technology, we can reach the key messages to our population in the community. And especially when we talk about the digital health, it's very important for us now that we would like to work with our partner, and we are looking forward for strengthening the collaboration and cooperation with various partners who are very much interested in this NCD prevention and control. And in the past and currently, we are receiving strong support from the government of China, and we very much like to express our deep appreciation to the support by the Chinese government to the Ministry of Health of Cambodia. And we will continue our tradition, as the friendship and cooperation between China and Cambodia. In terms of supporting by Chinese government to the health sector in Cambodia, generally speaking, we are working now in terms of infrastructure development. For example, like hospital development, construction of the hospital, and also exchange the skill and knowledge between the physician in those hospitals with the hospital in China. And we are having and working on how, when we develop the hospital, the technology should go along with that kind of hospital development. But this is a general support, and plus Chinese government also support the Ministry of Health in terms of referral, for example, like donation of the ambulance and other stuff, and then which are very useful to the Cambodian population to utilize. And we can see that these 200 ambulances now going around Cambodia, around the country already. And we are in the process of working more in order to strengthen the referral system also in Cambodia. But if we are tackling on the NCD, we should have the specific program or specific project in order to start with this kind of cooperation within the framework of the One Belt and One Road initiative. And during the time that my delegation coming here, we are very much looking forward to have more dialogue with the Chinese government as well as with the Chinese partner in order to explore the way on how we can cooperate better in terms of responding to NCD, particularly in the field of using the technology for the digital health. And what we can see, we can have some sort of communication and education and information using this kind of technology for our community to have a better awareness and knowledge on how they can prevent NCD by themselves. And at the same time, we can work on the way on how we can have the checking and screening, early detection. This is the one we would like to see, rather than waiting. So early detection for example, diabetes or high blood pressure, hypertension, for example, or cancer, that the people can seek the treatment in early stage, that they can save life as well as to reduce the cost for the treatment as well. So this is what we are planning to do. In terms of telemedicine, we are working with the university, because we need to strengthen the capacity of our health professional, and at the same time, we have what we so-called pre-service training and in-service training. So for the pre-service training, it need to have further collaboration with the University of Health Sciences, who are producing the health workforce. So once we have that, then when they come to work, so it will be easier for them to really helping to contribute for this NCD intervention. And telemedicine, somehow there is a way also to introduce quite a very few, and it's kind of in the early stage that we are adapting the new technology. So that's why I'm saying at the beginning that we are very much looking forward to have a further discussion on exploring area of collaboration and cooperation with China. Yeah, I may add that as you may know that in terms of partner working in the area of NCD control and prevention, of course there are a number of partner working in Cambodia, but somehow the support and the strategy and intervention is not in the state that we would like to see, It's kind of fragmented. So that's why we would like to see more in terms of strengthening the capacity at the national level, and also strengthen the ownership of the government as a whole, especially the Ministry of Health, to really monitor and implement this kind of NCD control and prevention. And some of the donor, and we can see according to the situation for the external assistance to the health sector in Cambodia right now, it seems that it's still lacking of support in the area of NCD. So that's why now I think my own personal opinion is that now is a timing that China and Cambodia can work together in order to tackle NCD, while Cambodia is pretty much looking forward to adapt the technology, for example like digital health or e-health, that we can really work, because China also has a lot of experience in terms of modern technology and also experience in NCD prevention and control. So we are very much looking forward to this cooperation.